in terms of advice for others to really keep your doors open and seek a bunch of mentors. I don't think it needs to just be one person or, one title per se. I think it really can be anyone, um, just depending on your personal preferences and maybe areas that you want to dive into deeper.
Hi, everyone. It's Vrushangi Shah with the Fellowship Review through the American Journal of Healthcare Strategy. Today, I'm thrilled to be joined by someone that I had the pleasure of working with during the ACAG conference. Madeline, thank you so much for being on the show today.
Thank you for having me. It is a pleasure to be here.
Yeah, so let's just get right into it. Why don't you go ahead and tell our listeners a little bit about where you're from, your educational achievements, and kind of a high level overview about you?
Let's do it. All right. So, my name is Madeline Cremin. I grew up in Chicago. Um, I went to the University of Missouri for my undergrad, where I studied health sciences. And then I went on into my Master of Healthcare Administration program. During my time at Mizzou, I had the opportunity to kind of dive into healthcare for the first time through various internships, project work, and then ultimately, the coursework in my master's program. Um, at the tail end of my master's program, I was accepted into a fellowship position, which, we'll dive into in more detail today. But this is at Nicklaus Children's Health System in Miami, Florida, where I spent a year there doing a bunch of project work, working with executive leadership, getting kind of that real world application of everything that we were learning in school. So it was a great experience where then I ended up networking and transitioning to Mayo Clinic, where am now, serving as a program manager for general internal medicine.
That is so exciting. And of course, we'll chat a lot about your fellowship experience because this is the fellowship review. But I do want to highlight a little bit more about your grad school experience, getting your master's at Mizzou, and specifically the administrative internship that you did at Mizzou. What was that experience like? Any projects during that time that you would like to highlight, and any memorable times from that internship experience?
Yes, that was a great experience. So I had an experience before that where I first was introduced into the hospital setting. So I was working as a care transition resource specialist at MU Healthcare. So that luckily gave me a little bit more background into the organization itself. And, learn things for the first time like health records, various policies, and again, just applying that knowledge. But really, my administrative internship was, I think back to it and just the experience I was able to gain from it was invaluable into, going into the fellowship and even applying things I learned today. But I had the opportunity to work under the senior director of ambulatory services, and she oversaw 60 plus clinics at MU Healthcare. And during this time, um, I remember I came on and the project that was starting out was smaller, but then it just ballooned into this whole reorganization of the revenue cycle prior authorization process. So again, it was like this huge undertaking where, I thought I was coming in to make this small change and it just became this huge project for the organization. And so that experience was one beneficial to get into the understanding of hospital versus physician billing and revenue cycle and what is a prior authorization and all of the various policies that go into billing and again contributing to that complexity of the healthcare system. And so that was probably my favorite project just because it kept going. We had the opportunity to work with a bunch of leaders and then really just rethink that entire process, but for all outpatient clinics. So it was, yeah, it was a great experience nonetheless.
Yeah, no, it definitely sounds like it. And like ambulatory spaces across health systems in the US definitely growing. Kind of a lot of people say, ambulatory is the future. So how cool that you got to do such an extensive project so early on in your career. And I think, one thing I'd like to draw attention to about something that you said is when you came into the project, it was kind of small, maybe the scope wasn't that big, and then you said it ballooned into something so much bigger. And I feel like there's that tends to happen in healthcare because there's so much work that needs to be done. You may come on a small project and slowly it kind of becomes bigger and bigger, and you get to learn a lot. So thank you for sharing that. Um and I kind of want to also dig a little bit deeper into fellowships. So I always tell my guests, when you get a master's of health admin or a similar degree, you have a lot of different avenues that you can go. You can join health tech, you could go the payer route, you could join consulting. Of course, you could do fellowships. So when you look back on your journey as a grad student, what specifically drew you to picking the fellowship route and pursuing that as opposed to other avenues you could have taken?
Yeah, that's a great question. I think a lot of it was, just hearing from peers who explored the fellowship route and those who didn't, who also talked highly of the fellowship position. Um, when I was considering applying, I really thought about what experience is going to, prepare me to keep growing in the future. And I think a lot of, any experience you're going to keep growing. Um, but really, I saw the fellowship as this opportunity to catapult yourself almost into like that 40 years from now. And then, obviously you come back and you're not fully there, but it's that insight into senior leadership and being a part of, this strategic decision making processes and understanding hospital operations as a whole, not necessarily just one department that you might see yourself in if you go another route other than a fellowship. And so I think when I was, thinking back when I was in grad school, it was just like, okay, I'm hearing all of these amazing things. I know it's a challenge and, you have to, it's hard work to get one, but why not? If I apply and get one, great. But if I don't, then of course I'd be open to exploring those other opportunities.
Yeah, absolutely. And I think that's a really great way of putting it. This idea that you get kind of a firsthand view of hospital operations strategy and just everything that goes into running a health system. And you kind of built a perfect segue into my next question for you, which is the fellowship application journey can be difficult. It's hard work. So what was that like for you? How did you go about picking the number of sites that you were going to apply to? How did you stay organized? And then finally, what do you feel you did that helped you get the interviews? So just overall, what was that entire cycle from the start of the application all the way through interview season like for you?
It was competitive, I'll say that, but in a great way. I think it really challenges you to be conscious of what you're doing, where you're applying, the effort that you're putting into it. And so, and again, I had a bunch of peers who were excellent resources, mentors who went through the same process, who were able to give me advice. And so ultimately, I think I applied to about maybe like 10 to 15 fellowships. I can't remember the exact number. Um, but, I took a lot of the advice from my peers. A lot of their recommendations for staying organized. I created an Excel sheet of, okay, when is this due date? When, have you reached out to the fellow on LinkedIn yet? Have you, just creating all of this checklist for each organization.
Yeah.
Um, so I got a little bit crazy with it, but you kind of have to just to stay organized because it becomes so tedious for each organization because there's the webinars that you need to join and the phone calls that you need to make and the applications themselves and really making sure that you're putting 100% into every organization that you apply to is key. um, so it was a tedious process, but looking back, I wouldn't have changed anything, obviously, because I was able to land a fellowship, which is a blessing in itself.
Yeah, absolutely. No, I love that. And I think, I feel like 10 to 15 is what I've been hearing a lot from a lot of the people that I've interviewed. And that seems to be kind of the range that most people go to. But of course, there is that people will only apply to a couple, or some people will go into the 20s. So I do want to call out like being intentional with where you apply is very important because, like you said, it's a competitive and difficult process. And of course, you landed at Nicklaus Children's, which is so exciting. When you look back at your final round interview with them and what that was like, was there something that really stuck out to you where, you knew you were going to accept the offer and you felt, what was it that called you to say yes to Nicholas Children's?
It was exactly that. It was the final round interview. It was being there in person, meeting with people face to face, walking and, getting a tour of the hospital. And so Nicklaus Children's is a children's hospital. And so seeing the culture and environment there, you feel the warmth and positivity that children's hospitals can bring, just, trying
Mhm.
to provide that warm environment for, the children that they're serving. So I truly think it was that on-site visit where, I had the opportunity to meet and network with different individuals that ultimately led to me falling in love and, accepting.
Yeah, yeah, I love that, falling in love. And I think, seeing things in person and interacting with people in person, especially at something like a final round, can be game changing because you can actually get a feel for, the people, the vibes, and just the environment that you could potentially be in. So I appreciate you sharing that. For people who are interested in the Nicholas Children's administrative fellowship, can you just give like a high level overview? So, is it 1 year? Is it 2 year, project based, rotation based? And also, do you have a co fellow? Kind of what's the setup of the fellowship like?
Sure. So I'm going to answer that a little bit differently, probably, than the average person. So when I was in the fellowship, it was a 1 year program with one fellow. So you were the only fellow, which has its perks of, again, being the only fellow. Any projects that come up, folks turn to you first.
Mhm.
Um, Today, it is still a 1 year fellowship. However, there are two fellows, which I think is a great thing because having that co partner who's in that same position as you can really be valuable, especially while going through this transition from, grad school into the real world environment. Um, but aside from that, I think everything else is the same. So it is a rotation based, I mean, it's kind of a mix between rotation and projects. Um, and it's really, I think this Nicholas Fellowship, from after talking to other people, I think it differentiates itself in that it's really dependent on the fellow themselves for the rotations that they want to do, how long they want to be in those rotations, and the project work that they join. And so you kind of do rotations and projects all at the same time, just based on, your schedule. I think you kind of start off doing more rotations just while you're getting, you know, making this transition, getting used to the work environment and just again learning the organization. And then again, the project work takes off and then, that becomes the majority of the fellowship towards the end of it.
Yeah, absolutely. I love that. A good mix of rotations and projects. And then also, I think I agree with you completely. Having a co fellow, one or even more than one, it's so helpful, right? Because it takes away that like loneliness or isolation because. The fellowship is such a unique experience that having a partner, especially during fellowship recruitment, can be like a game changer.
Oh my
um,
gosh, that would help so much.
Yes, exactly. And I think obviously you did it alone, but I'm sure that whoever came after you was thankful that they had a partner to navigate that very competitive process. I think even from an organization standpoint, right? It's about recruiting the right the right fellow for the next year. So I completely understand that. Another reason why people tend to pursue fellowships is their mentorship structure. And so, could you maybe also give a little bit of insight into, do you have a traditional preceptor in this fellowship, or did you feel that you were able to kind of build mentors throughout the health system?
You It's both again. So you have the traditional mentors in terms of those executive leaders. You have one-on-ones with the CEO and the COO, who really serve as that traditional, standing meetings who give you, advice on what to do and have those check-in points. But again, it's up to you to also seek out other mentorship that maybe aren't presented to you in that traditional format. And so, yeah, the opportunity to kind of identify a few others, which, once that door opens, other project work opens up. And yeah, I would just say for, in terms of advice for others to really keep your doors open and seek a bunch of mentors. I don't think it needs to just be one person or, one title per se. I think it really can be anyone. Um,
Mhm.
just depending on your personal preferences and maybe areas that you want to dive into deeper.
Yeah, absolutely. And any fellowship projects or any rotations that you did that really stuck out to give our listeners an example of, what that project experience or rotation experience was like?
So I mean there was a bunch. I think back to one that I didn't realize how I, I don't know how much experience I gained from it in the moment until afterwards, and reflecting back. But I had the opportunity to work with the VP in quality and the infectious prevention and disease team at Nicklaus Children's to really improve the hand hygiene compliance at Nicklaus Children's. And so with that, it came kind of, this whole process improvement project from, looking at how we're measuring hand hygiene compliance all the way to rolling out a different hand hygiene product to then also, it just ballooned into this whole project. So essentially, we knew hand hygiene was low, but at the time the way that we were collecting data was on a clipboard where you would go at floor to floor and, you'd have someone be just marking if they were, being compliant with hand hygiene after seeing a patient. Again, that mixes the data a little bit since if someone sees a clipboard, immediately their thoughts are like, what is going on? It's not natural. This feels weird. And so to address that, we worked with an external company called Intelligent Observation. And this was something that goes on your badge or little sensor and it tracks if you're hand hygiene, compliant with hand hygiene. So
Wow.
essentially, if you're close enough to a hand sanitizer machine for the amount of time or washing your hands for a certain amount of time, it tracks that. And so, that was really how we addressed that issue. And then the second portion of that was okay, once you have all of this data, how do you apply it? How do you work with the different department leaders to actually address hand hygiene, which becomes a lot easier when you can track it down to the individual. But, you know, again, that each project comes with so many different learning opportunities, in terms of working with external partners to rolling something out that seemed as a little controversial to, um, the staff who was on the floor and, directly affected by this.
Mhm.
Um, so I think back to that project a lot, just in terms of, all of the different layers that that one project had.
Yeah.
But again, it was, one of my favorite things of process improvement. And so I think when you're able to actually see the results of the project and like provide more data to it, it
Yeah.
like geeks me out.
Yeah, yeah. Data is incredibly important. So thank you for sharing that. And this episode's been so fun because I feel like I learned a lot about your experiences at Nicholas. Even though I met you while we were still fellows, I don't know that at that time we got to kind of dig deep into your experience. So I really appreciated you sharing all this. Kind of the last two questions that I always like to take this my guests on are related to living in the city and the state where the hospital is located, and then also just like general advice. So kind of starting with that first question, oftentimes with fellowships, people move cross country, completely brand new state, brand new city. And of course, you being from Chicago, having gone to school in Missouri, Florida was quite the move. And so, what do you want to share to our listeners about living in Miami and kind of what that experience was like and what should they anticipate?
Good question. So you're absolutely right. I think it's so different visiting versus living somewhere. Before the fellowship, I had the opportunity to visit Miami, in short stays. But again, that is so different from actually living there. Um, when I was applying to fellowships, I really had the dream of going somewhere warm, being by the ocean. I grew up in the Midwest. I was ready
Uh,
to, try something different in so many different ways, but living being one of them. And so I was just excited by the opportunity to go to South Florida.
mhm.
Um, South Florida is and people would tell me this before coming, and I was like, "Okay, yeah, I know it's different," and everyone is like, "No, but it's truly like a different world. Like, it's not anywhere else like, in the US." And I was like,
Yeah.
"Yeah, sure." Everyone probably says that, and it's true. I think, um the culture is so different. There's a lot of Spanish speaking individuals and, Cuban restaurants, and Cuban coffee became like my go to. If you've ever had Cuban coffee, you would know what I'm talking about. But it was it was a positive learning experience, just learning different cultures and being immersed in it.
Yeah, no, that's good, that's good. No, I love that. And, kind of the final question, um, when you look back at your fellowship cycle, I'm sure there were times where you were like, "Oh, this is really difficult." I'm sure there were highs and lows where you got interview offers, but you also got rejections. Ultimately, though, you were able to land a fellowship, right? So, what general advice do you think you'd wanna give someone who's interested in going through the fellowship cycle? What's something like key takeaways from your own application process where you're like, I this is advice that I want to pass on to everyone. Everyone must know this.
Yeah, I think it's probably pretty generic, but something that wasn't top of mind when I was going through it. I really saw the fellowship experience of like, okay, getting that experience, doing a bunch of different projects and learning as much as I can. And I think if I were to redo my fellowship, I would focus more on building those deeper relationships with the mentors and leaders throughout the organization. I think I gained a lot from those formal projects, but I think a lot of those invaluable insights came from those, one-on-one conversations with executives. And so I think I would just advise those future fellows to really, take every opportunity to ask questions and seek feedback and really learn from those around them and, be a sponge. That was the biggest advice I got. And tried to implement. It's hard when there's so much to absorb, but
Yeah.
yeah.
No, I love that advice. I think overall, I also share with a lot of people like focus on the relationships, of course, focus on your projects, but an added like layer that I would say is also focusing on shadowing experiences and getting kind of on the floor, trying to see if you can go watch a surgery or go follow, someone in the cafeteria for a day. I feel like there are so many things fellows have access to, so if you have a wish list of things you want to see, you definitely should ask your preceptor and find a way to get that experience. So no, I appreciate your advice. Very helpful. And, those are kind of all the formal questions I had, but really appreciated reconnecting with you and kind of you sharing your journey because, of course, you have such a unique journey. You've moved around quite a bit, have experienced health systems in three different states at least. And so I think it's good to bring that perspective up forward. And also, I appreciate having a children's hospital, someone from a children's hospital come on board because there are less children's hospital fellowships than there are just the regular adult hospital. So we have to bring the children's hospitals to light.
Yes, advocate the children's hospitals. I love that. No, but
Yeah.
thank you. This has been a great opportunity. It's always great to see you. It's been a long time, so we need to connect outside of this as well. But no, thank you. You've been amazing.